This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about cervical disc replacement versus cervical fusion. If you like this video, we put out new content weekly, so please like and subscribe. So cervical fusion versus cervical disc replacement. So as the name implies, in one of them, you remove the disc and you put some bone in between the two cervical vertebrae and you put a plate and screws and you fuse it. Meaning that your goal is to get, the plate and screws are meant to hold everything in place, but the goal is to get the bone to fuse the bone. That's what we call a fusion. So now there'll be no motion at that level, and that level is decompressed and fused. Cervical disc replacement is newer, and instead of fusing the bone by removing the disc and putting bone in between them, you remove the disc and you put an apparatus to make it so that the neck can still move while still being decompressed. So, there's obviously a lot of information about both of them out there. Most of the motion in your neck come from the C1, 2 level, like all the way at the top, and most people's fusions are lower down, so they don't actually lose that much motion, even if they have a few levels fused. If you get fused from your head, like your cranium to C1 or C1 to C2, that's when you lose a lot of motion, but most of the disc replacements are from C2 down. Anyways, so if it were me, I would get a fusion, and you might be asking why wouldn't you want a disc replacement? There's just not super great long-term studies, and I've had personal patients I've seen that have gotten these replacements, and over time their symptoms sort of start coming back. You're also talking about putting metal and plastic really, really close to the spinal cord, and I saw one lady who got injured in a car accident, and she was doing fine before, but it moved it slightly, and she really did terrible afterwards. And I think she needed to get converted from a disc replacement to a fusion. Proponents of disc replacements will argue that since you're preserving the motion, you'll prevent the arthritis at the above and below levels. And that's probably true, but the arthritis takes like a decade or two to develop, and will the disc replacement last that long? And I just don't think we know. So if it were me, and let's say I had like a C5, 6 disc and it was really bad and I needed surgery, I would not get a disc replacement. I would just get it fused. You talk to spine surgeons and some of them will swear by disc replacements, but I mean, some of them are even doing like multi-level disc replacements. But if it were me, I would fuse it, or I'd get it fused, I should say. But again, not super great data on there. And certain surgeons have specific preferences, so some won't do disc replacements and some only want to do disc replacements. But yeah, again, I don't think we have super great long-term studies on these things, and I would feel not super confident that if that thing starts having problems, it's so close to my spinal cord, it makes me feel uncomfortable. So I hope I was able to give you some insight in cervical disc replacement versus a cervical fusion. If you have any questions for me, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.